Right now, as we speak, there's a massive bill sitting on the Senate floor that could fundamentally change how millions of seniors receive their Social Security benefits and healthcare coverage. And most people have no idea what's really buried in those hundreds of pages. Are you one of the 65 million Americans who depend on Social Security? Or do you have elderly parents who rely on Medicaid for their nursing home care? Because what happens in the next few weeks could determine whether your benefits stay the same, get reduced, or face completely new restrictions that nobody saw coming. If you're concerned about protecting your retirement security and want to stay ahead of these political changes that could impact your financial future, make sure to subscribe to this channel right now, because I break down complex legislation into plain English so you can make informed decisions about your money and benefits. Let me tell you what's actually happening behind the scenes in Washington right now. President Trump's comprehensive tax and spending bill isn't just about giving people tax cuts. It's about reshaping the entire safety net that seniors have relied on for decades. The bill does extend Trump's previous tax cuts, which means many seniors will see some tax relief. But here's what they're not advertising on the evening news. To pay for these tax cuts, Congress is looking at trimming spending from programs that millions of seniors depend on daily, and Medicaid is at the top of that list. Now, when most people hear Medicaid, they think it's just for young, low-income families, but that's completely wrong. Did you know that Medicaid pays for about 60% of all nursing home residents in America? It covers home health aides, adult day care, and all those long-term care services that Medicare simply doesn't pay for. So when politicians talk about tightening Medicaid eligibility or adding work requirements, they're potentially talking about cutting services that keep seniors in their homes instead of forcing them into expensive institutional care. The scary part is we've seen this playbook before. Remember what happened in Arkansas a few years ago when they implemented work requirements for Medicaid? Thousands of people lost their coverage, not because they weren't working, but because they couldn't navigate the confusing online reporting system or missed a deadline for paperwork they didn't even know they needed to file. Can you imagine being 70 years old, trying to prove your work status online every month just to keep your nursing home coverage? That's the kind of bureaucratic nightmare that could be coming if these changes go through. But here's where it gets even more concerning for seniors. The bill includes provisions that would dramatically change how federal employees work, including the people who process your Social Security claims and answer phones at your local Social Security office. Right now, these workers have job protections that help them focus on helping you rather than worrying about getting fired for taking too long to explain your benefits. Under the new rules, most federal workers could be fired much more easily, and they'd have to pay for their own job security insurance if they want protection. Think about what this means when you call Social Security with a question about your benefits. If the person helping you is worried about their job security, are they going to take the time to really understand your situation and give you accurate information? Or are they going to rush through calls to meet quotas and avoid getting fired? The ripple effects of these employment changes could mean longer wait times, more mistakes in benefit calculations, and fewer Social Security offices staying open in rural areas where seniors need them most. There's also a hidden provision in this bill that targets union dues with a new tax. Why should seniors care about union taxes? Because many retirees rely on unions to advocate for pension protections, healthcare benefits, and Social Security improvements. When unions have less money to operate because of higher taxes, they have less power to fight for the interests of current and future retirees. It's an indirect way of weakening the political voice of seniors without directly saying that's the goal. The healthcare implications go even deeper than most people realize. Small rural hospitals, which many seniors depend on because they can't travel long distances for care, are already struggling financially. These hospitals often rely on Medicaid payments to stay afloat because they treat a lot of low-income patients who can't pay their bills. If Medicaid funding gets cut or restricted, some of these hospitals might have to close their doors entirely. Where does that leave a 75-year-old living in a small town who needs emergency care or regular medical monitoring? Some senators are trying to add emergency funding to help rural hospitals survive these potential cuts, but other lawmakers are fighting against spending any additional money. So we have this situation where Congress might cut funding that keeps hospitals open, but then argue about whether to provide emergency money to keep them from closing. Does that make sense to you? Now, let's talk about something that got removed from the bill but shows you the bigger picture of what's happening. Originally, this legislation included provisions that would have limited federal judges' ability to block presidential orders nationwide. The idea was that if a judge disagreed with a new rule about Social Security or Medicare, they could only stop it in their local area. not across the whole country. That provision got removed because it violated budget rules, but it reveals the broader strategy of concentrating more power in the executive branch and reducing checks and balances from courts and agencies that often protect seniors' rights. Here's what really keeps me up at night about all of this. The Senate is using a process called reconciliation to pass this bill, which means they only need 51 votes instead of the usual 60. They're also planning something called a Voterama, which is basically an all-night session where senators can propose unlimited amendments to try to change parts of the bill. It sounds chaotic because it is chaotic. Important decisions about your benefits and healthcare could be made at 3 a.m. by tired senators who haven't had time to fully understand the consequences of their votes. So what does this mean for you practically? If you're currently receiving Social Security, your monthly checks aren't going to disappear overnight, but the service quality and accessibility could decline significantly. If you're planning to apply for Social Security in the next few years, you might face longer processing times, more bureaucratic hurdles, and fewer local offices to visit for help. If you or a family member might need Medicaid for long-term care, the eligibility requirements could become much stricter, and the application process could become a nightmare of paperwork and deadlines. The timing of all this matters too. The House of Representatives has their own version of tax and spending changes, and if the Senate passes something different, both chambers will have to negotiate a final compromise. This process could drag on for months, creating uncertainty for seniors who are trying to make important decisions about their care, housing, and finances. Should you move to be closer to family? Should you sell your house and move to a retirement community? Should you apply for Medicaid assistance now before rules potentially change? These are the real-world questions that seniors are grappling with while politicians debate in Washington. Here's my advice for getting through this uncertain time. First, don't panic, but do pay attention. Make sure all your paperwork is current and organized, including Social Security statements, Medicare information, and any Medicaid documentation. If you think you might need long-term care assistance in the future, start researching your options now before any rules change. Talk to a trusted financial advisor or social worker who understands these programs and can help you prepare for different scenarios. Most importantly, stay engaged with what's happening. These aren't just abstract policy debates. They're decisions that could affect whether you can afford your medications, whether your local hospital stays open, and whether you can get help paying for the care you need as you age. Your voice matters in this process, and the more seniors speak up about how these changes would affect their lives, the more likely Congress is to consider the real-world impact of their decisions. What questions do you have about how these changes might affect you or your family? Are you worried about specific benefits or services? Leave a comment below because your concerns help me understand what to cover in future videos. And remember to subscribe so you don't miss updates as this legislation moves through Congress.